Hi, and welcome back to Abnormal Psychology. And here we are in part 2 looking at sleep-wake disorders. Now, sleep is a normal biological function, yet how do we do it? Why do we do it? Well, sleep is a restorative. It's restorative, so it sort of like rebooting your computer in a way, and we seem to need it. Well, the only way we know that is try not sleeping and see how long you can do that for before you just drop off. Most of us get tired at night. We go to bed and can sleep, no problem. However, some cannot and have some very significant problems getting to sleep or remaining asleep, affecting their lives at work, interpersonally, and in many ways, these are, by the DSM-5, known as sleep-wake disorders, a diagnostic category representing persistent or recurrent sleep-related problems that cause significant personal distress and impaired functioning. Consider Jim. He's a student with a history of having sleep problems. He reported that he never slept well, had trouble falling to sleep, and waking again in the early morning. Since he started school last year, his sleep problem had gotten worse. He would lie in bed awake until the early morning hours thinking about school, getting only 3 to 4 hours of sleep on a typical night. In the morning, he had difficulty getting out of bed and was frequently late for his early morning class. Jim's sleep problems and their interference with his schoolwork were causing Jim to experience increasingly severe depression. In addition, he recently reported having a severe anxiety attack that woke him in the middle of the night. All of these difficulties caused him to be increasingly isolated from family and friends, who finally convinced Jim to seek help. So let's look at sleep-wake disorders. Sleep disorders form a diagnostic category representing persistent or reoccurring sleep-related problems that cause significant personal distress or impaired functioning. You see the theme when we get through all of these. It's always along those lines. It is with the use of a polysomnograph, PSG, recording which simultaneously measures multiple physiological responses during sleep or attempted sleep. It is used to assess sleep disorders, and there are a number of sleep-wake sleeping disorders, and we're going to consider insomnia disorder, hypersomnolence disorder, narcolepsy, breathing-related disorders, circadian rhythm disorders, and parasomnias. Insomnia disorder we're going to start with. People who suffer from insomnia disorder, difficulties falling asleep. They also have difficulties remaining asleep or gaining in or achieving a restorative sleep. The University of Ottawa psychologists found that high levels of anxiety were associated with moderate to severe sleep-onset chronic insomnia. High levels of life stress, work stress, heavy drinking or cannabis use, obesity, these are all factors that can contribute to not getting a good sleep. Chronic insomnia involves having difficulty falling asleep, remaining asleep, or getting a restorative sleep for a period of a month or more. That's going to certainly affect your day-to-day life. Hypersomnolence disorder. In people suffering from this disorder, a persistent pattern of excessive sleepiness during the daytime is observed. Now, these persons do not feel refreshed after having a daytime nap. This is not the kind of sleepiness you might have from time to time, where taking a nap can restore us. This is chronic and where naps are not helpful. Now, this next one is called narcolepsy, and it's a peculiar one. Narcolepsy is a sleep-wake disorder characterized by a sudden, irresistible episode of sleep. You have a sleep attack, if you will. It's accompanied by cataplexy. Now, cataplexy is a brief and sudden loss of muscular control, typically lasting a few seconds to as long as a couple of minutes. So when this sleep attack occurs, the person goes directly into REM sleep stage. That's the stage of sleep where we often will be dreaming. I once had a student in my class who experienced narcolepsy, and she brought a pillow into class and a friend. So whenever she dropped off to sleep, the pillow could be used to protect her head. She would be in mid-sentence sometimes, and then directly, bang, down, sleeping for a couple of minutes or so. And then she'd wake up, and she's back at it again. Breathing-related sleep disorders. Now, you may know people with breathing-related sleep disorders experiencing repeated disruptions due to respiratory problems. These frequent disruptions of sleep result in insomnia or excessive daytime sleepiness. The term apnea means the temporary cessation of breathing. If you yourself have experienced someone with apnea, you know they just stop breathing, and it could be even a couple of minutes before you hear an inhale. Obstructive sleep apnea, hyponia, is a type of breathing-related disorder involving repeated episodes of either complete or partial obstruction of breathing during sleep. There are machines that you can use to help with the breathing at the night for sleep apnea. Now, this next one is kind of another peculiar one. It's called circadian rhythm sleep-wake disorder. Our circadian rhythm is our 24-hour clock that guides our waking and getting tired and sleeping in a 24-hour day. Hormones or levels of the sun all contribute to our bodies prepping us for sleep and getting us ready to wake up. Circadian rhythm sleep-wake disorders are sleep disorders characterized by disruption of our sleep caused by a mismatch in sleep schedules between body's internal sleep cycle, or the sleep-wake cycle, which is our circadian rhythm, and the demands of the environment. So if we stay up until 3 in the morning and get up at 8, and then the next day we go to bed at 11 and get up at 2, it's giving you some perspective that we can disrupt our circadian rhythm by having inconsistencies in our sleep. And some of that is environmental pressures of our work or social life. The disruption in normal sleep patterns can lead to insomnia or hypersomnia. The next category we're going to look at is parasomnia. Now, parasomnia is a category of sleep-wake disorders involves the occurrence of abnormal behaviors and physiological events during sleep or at the transition between wakefulness and sleep. It is further divided into disorders associated with REM sleep and those associated with non-REM sleep. Now, nighttime disorder. Now, it's a recurrent awakening due to a frightening dreams, nightmares more notably. Nightmares typically will occur in our REM sleep, and this stage of sleep usually involves a type of paralysis, which is handy as jumping out of bed and running away could be very dangerous. Non-rapid eye movement sleep arousal disorder involves the recurrent episodes of incomplete arousal during sleep that are accompanied by sleep terrors and sleepwalking. Well, what are sleep terrors? Well, sleep terrors, you might know somebody, a child in particular. You'll recognize this in someone as while they were sleeping and they yell out with a piercing scream sometime in the night. Well, this is more often with children, and they'll often just sit up quickly and be sweating, disoriented, and still be asleep. After a while, the child will fall back to sleep and remember nothing about it in the morning. Sleep terrors involve repeated episodes, and children typically grow out of them, although at some percentage it affects them in their adult lives. Sleepwalking, though, is repeated episodes of someone getting up and walking around while remaining completely asleep. Now this occurs during deep sleep stages. They tend to have a blank stare and don't usually bump into things. Accidents can happen though. An awakened sleepwalker will not be harmed by waking them up. They may be somewhat disoriented, but they'll be okay. So what about treatment of sleep-wake disorders? The biological approach is the most common pharmacological method of treating sleep-wake disorders in Canada has been the use of sleep medication. However, because of problems associated with these drugs, non-pharmacological treatment approaches, principally cognitive behavior therapy, have become much more popular more recently. Psychological approaches were mostly limited to treatment of insomnia. Cognitive behavior techniques focus on lowering states of physiological arousal, modifying maladaptive sleep habits, and change dysfunctional thoughts, using relaxation techniques, stimulus control, and anxiety management training. Now, cognitive restructuring, this is the substituting of self-defeating maladaptive thoughts with some more rational thoughts. Now, if you check in your text under the closer look, there's examples in your text and at the end of the chapter that might make this more clear for you. All right, there we go. That brings us to the end of this chapter on, well, in part 2 at least, on sleep-wake disorders. All right, everybody. See you next week. Bye now.